You hear a lot of debate these days over whether or not the United States should have socialized medicine like the rest of the world. Actually, we already have it. Anybody 65 years or older is covered by socialized medicine in the United States. That market for healthcare is controlled entirely by the federal government, which decides what it will pay doctors and hospitals for the services they render. We call it Medicare. The decision of how much to pay are based not on the economics of supply and demand, but on politics. So not surprisingly, fewer and fewer doctors are accepting Medicare patients because they're not being fairly compensated for the services they are providing. Simultaneously, Medicare is slowly going broke. In actuality, it's been broke for many years, with most elements of Medicare being funded by income taxes and not by the so-called Medicare tax that most of us pay. As you can see from this chart, the only self-sustaining portion of this bloated program is Part A, which pays for inpatient hospital care. It's now projected that this part of the program, too, will begin spending general tax money in just a few short years. As the chart also shows, Medicare patients are only paying about 1/4 of the premiums they should be paying for this program to be sustainable. The rest is being paid by young people who likely will never get the level of care being enjoyed by today's boomers. So even though the government is paying doctors and hospitals less than the market value for their services, Medicare patients are still paying way below market prices for their benefits. In this kind of system, they have little or no incentive to use those services wisely. So waste and overuse is rampant. People like to pretend that healthcare is exempt from the laws of supply and demand, and that the government can set wages for doctors and prices for pharmaceuticals without any impact whatsoever on the quality or timeliness of those services. Ridiculous. Doctors and pharmaceutical companies have to make huge investments in the drugs and services they provide. It now costs about $2.5 billion to bring a single medicine to market in the United States. Does it make any sense at all that companies and doctors are going to make the same investments and continue to operate at the same level that they are now once the government determines the value of their goods and services? Despite its substantial problems, Medicare is probably the best socialized medicine system that currently exists in the world. Why is that? The one and only reason is because the rest of the country's healthcare system has not been socialized. The rest of the country's healthcare system is still controlled, to some extent at least, by the laws of supply and demand. That means that if a doctor develops an exceptional skill or a pharmaceutical company develops an exceptional drug, they get paid a premium for the hard work and huge investment that it takes to make these things possible. The Medicare system has been kept afloat by the private market, and the quality of doctors and pharmaceuticals in the United States continues to be the best in the world. And before there's any argument about whether or not that's true, I've got a question for you. Let's say that you have a heart problem. Would you rather be treated in Cuba or at the Mayo Clinic? I'll even give you the public service hospital in the United Kingdom. Any takers? Anyway, the United States continues to produce the best doctors and pharmaceuticals because there is still a system in place that allows them to be fairly compensated for their efforts. This system is the only thing that allows Medicare in its current form to exist. I think it was good old Bernie Sanders who started the campaign for Medicare for All, which is brilliant, really. He's taking the best socialized medicine system in the world because it's being funded by private markets and claiming this can be provided magically to every resident of the United States once the private markets are gone. I mentioned the UK previously. There actually is one sector of the UK health system that's functioning quite well at the moment. It's the private market system controlled by supply and demand, which is allowing some patients to bypass the dangerously long waiting times and what we would consider to be inferior service now being provided in their version of Medicare for All. Be careful what you wish for, America, because if you're successful in implementing Medicare for All, the inevitable result will be Medicare for none.